Hello doctors and medical students. Today I will discuss an important topics in renal chapter, that is renal glycosuria and elementary glycosuria, and along with those I will discuss or talk something about Fanconi syndrome. So dears, first of all, what is glycosuria? Glycosuria normally this means passage of glucose in urine. That is passing of glucose in urine is we call it glycosuria, and there is two main type of glycosuria. One of this is renal glycosuria and another one is elementary glycosuria. First of all, let me tell you something. What is renal threshold? Renal threshold means the above the plasma concentration of a thing above which it used to pass with the urine. This is a renal threshold. That means such as renal threshold of glucose is 180 milligram per dl. That is when the glucose concentration of plasma will be more than 180 milligram per dl, then the excess amount of glucose will pass through urine and will cause glycosuria. So normally what happens, we used to eat carbohydrate and it goes to the stomach, then up from the stomach a little portion of the food particles goes to small intestine after a definite time period. That is whole food don't go through small intestine from stomach at a time. It goes in small amount, part by part. So when a small portion of the glucose goes to small intestine from stomach, then that portion of glucose will absorb and that will rise the glucose concentration of the blood, but it will not cross, definitely it will not cross the at 180 milligram per dl. That is which is the renal threshold for glucose. But when a patient have no stomach, in case of patient of gastrectomy or gastrojejunostomy, when a patient is suffering from carcinoma stomach, then we have to resect the stomach, or that is a gastrectomy, and we used to perform gastrojejunostomy. So there is no functioning stomach there, so there are no pulsatile passing of food from stomach to small intestine. In this case, what happens, whole food particles directly goes to the small intestine instead of having their resting time in stomach. So whole food particle is going to small intestine at a time, so that will cause excess passing of carbohydrate at a time in the small intestine, and which will cause excess reabsorption of the glucose from small intestine, and that will definitely increase the glucose concentration in blood. And when it will exceed more than 180 milligram per dl, that is when it will exceed the plasma concentration of glucose more than 180 milligram per dl, then definitely it will pass through urine. The excess amount of glucose will pass through urine and will cause glycosuria. And as this glycosuria is caused by alimentary pathology, so we named it elementary glycosuria. And what happens in elementary glycosuria, there is a transient rise of plasma glucose concentration after meal, after 1 hour of the meal. Then after a definitive time period, like after 2 hours, the plasma glucose concentration will be normal again. But during the rising concentration of the glucose, it will pass its excess amount of glucose in the urine through renal tubule. So it will cause alimentary glycosuria then. And what is renal glycosuria? Renal glycosuria means normally what happens, the glucose used to filter through the glomerulus and comes to the Bowman's capsule, then it goes to the proximal convoluted tubule, and from there the glucose is reabsorbed through glucose transporter. Like glucose from glomerulus comes to Bowman's capsule, and from them it comes to proximal convoluted tubule, and from proximal convoluted tubule whole amount of glucose is reabsorbed, and this reabsorption occurs through definitive transporter, that is called glucose transporter, and glucose is always reabsorbed with another particles, that is sodium. So this is called sodium glucose transporter, and this is type 2. So glucose from proximal convoluted tubule is reabsorbed through sodium glucose co-transporter 2. When the sodium glucose transporter is damaged or mutated, that is when mutation occurs. So, mutation means permanent change in configuration. So when this sodium glucose transporter is permanently damaged genetically, then what happens? Glucose will not be absorbed through this glucose transporter, because now this glucose transporter are abnormal. There is no chance of reabsorption of glucose. Then what will happen? Then the glucose which comes from glomerulus, Bowman's capsule, it will not be absorbed, and whole amount of glucose will be passed through urine. Whole amount of glucose will pass through urine, and this is renal glycosuria, because the main pathology is from renal or from kidney. So in this case, what happens? The blood glucose level is normal, less than 180 milligram per dl, but the glucose that is filtered, it is supposed to reabsorbed again by glucose transporter, but due to damage or permanent mutation of this glucose transporter, glucose is not absorbed, so glucose will be drained along with the urine and will cause glycosuria, and as it is caused by renal pathology, it is then called renal glycosuria. Hope you have understand. Now, what is Fanconi syndrome? Fanconi syndrome is, before discussing about Fanconi syndrome, we have to know something very much basic. So what is Fanconi syndrome? Fanconi syndrome is generalized dysfunction of the PCT or proximal convoluted tubule of the kidney. So what is Fanconi syndrome? Generalized dysfunction of the proximal convoluted tubule. Then the question will be, what proximal convoluted tubule usually do, or what is the function, what are the function of the proximal convoluted tubule? The main function of the proximal convoluted tubule is complete reabsorption of the glucose, complete reabsorption of the amino acid, that is the unit particle of the protein, that is the unit particle of the carbohydrate is glucose, unit particle of the protein is amino acid. So main function of the proximal convoluted tubule is completely reabsorption of the glucose, completely reabsorption of the amino acid, and reabsorption of the bicarbonate. So three main important function: absorption of the glucose, absorption of the amino acid, and absorption of the bicarbonate. So when there is generalized dysfunction of the proximal convoluted tubule, what will happen? There will be no glucose absorption. So if there is no glucose absorption, what will happen? Glucose will drained with the urine and will cause glycosuria, and the amino acid also will be drained along with the urine and will cause amino aciduria. And as bicarbonate is drained with the urine and is not reabsorbing, so what will happen? Bicarbonate used to neutralize the acid in our body. We know bicarbonate is a basic chemical which used to neutralize our acid inside of our body, inside our blood. So if bicarbonate is if bicarbonate are losing from our body, then that suggests that the excess amount of acid is not neutralizing as bicarbonate is passing through the urine. So what will happen then? It will cause acidosis, and as this acidosis is caused by the renal pathology, as we know, proximal convoluted tubule is not working, so bicarbonate is not reabsorbing, so acidosis is occurring in our body. So as this acidosis is caused by renal pathology, so another name of this acidosis is renal tubular acidosis. I think you have understand this. So the Fanconi syndrome, what is Fanconi syndrome? Very much easy, very much normal. I assure you. Just let us confine it again. Generalized dysfunction of the proximal convoluted tubule. Fanconi syndrome is a generalized dysfunction of the proximal convoluted tubule. So there is no reabsorption of the glucose, no reabsorption of the amino acid, no reabsorption of the bicarbonate, and causing glycosuria, amino aciduria, and as bicarbonate is losing from our body, it will cause renal tubular acidosis. So dear, thanks for today. Thank you all.